following program does not necessarily represent the views and opinions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Good afternoon and welcome to the Liquid Green Health Show with your hosts Fred and Janet Cox right here on Reality Radio 101. To get on board right now, send us an email. Our email address is liquidgreenhealthshow@gmail.com. And now, ladies and gentlemen, right to your hosts of the Liquid Green Health Show, Fred and Janet Cox.
Yeah. Good afternoon. Excitement.
Yes, it is an exciting day today, actually.
March the 19th, and it still feels like winter out there. Where is spring? Good afternoon, everyone. We are the Coxes, and we are your hosts for this evening. We are into your space once again. Want to thank you for that. So wherever you are, whether it's in Canada, United States, or anywhere in the world, we want to thank you for allowing us into your private space.
Like the Netherlands or Spain.
Yeah, wherever you are,
Or Guyana.
or even Jamaica, right?
Mm-hmm.
Trinidad, Aruba. This is the Liquid Green Health Show, and this and all of our past broadcasts are on Spotify. Okay, we're also on YouTube, so all you have to do, go to those sites and you type in Liquid Green Health Show, hit us up, hit the like, the share, the comment button if you're watching us on YouTube, the subscribe buttons, do all of that, give us a boost, and also send us a line, drop us a line rather.
Yes, we really do love to get those emails.
We love to get those emails. Let us know where you're listening from. It's liquidgreenhealthshow@gmail.com. Please send us your thoughts and, give us some tips. Every Sunday at this time, we have a lot of fun, right?
Well, at least you do.
I do. I have a lot of fun on the air, folks.
But I think you have way more fun.
Yeah, because we're offering tips. We're doing it in an edutainment format, and it's designed to stimulate the mind and to help us to, bring us one step closer to living a healthier lifestyle.
And I do believe, based on that email that we got a couple of weeks ago, where she expressed the fact that we can take serious topics like today's topic, really serious. But life is short.
You gotta have fun.
Information needs to get out there.
Yeah.
But we don't have to leave depressed.
Precisely.
Right? Okay.
So that's the nature of the show, to bring information to you in a format that is not, as you said, depressing. Put a little punch, a little fun to it, right? Now this weekend, big St. Patrick's Day
last
week. No, it's Friday.
Yeah,
Saturday, Friday, the 17th. Yeah. And I know a lot of Irish, they're still celebrating. They're still enjoying those green ham and eggs. Right? So, if you are in that space, folks, happy St. Patrick's Day to you. Enjoy
lots of green drinks.
Yeah.
Right?
Enjoy the green beer and the green burgers or whatever. Enjoy it. Okay, and last week we also touched on food. We touched on healthy foods that are out there. We touched on a number. We couldn't go through all of them. No. There were like 100.
There's too many.
Yeah, too many.
We never really touched on the ones that we think are good for us, but really aren't. We did talk a lot about the processed foods, etc.
Yeah.
But there are so many of the ones that we figure, oh, this is good, and then you read and say, oh my gosh. But that's for another show.
Yeah. But then you know what the harsh reality is? It's very difficult to avoid processed foods.
Yeah.
Very, very difficult, because just about everything out there is processed. But again, we can mitigate the risk of eating too much of it.
And I hope
stay
you
as healthy as
enjoyed your burger that you had this week.
Yes, I did.
Okay.
And I'm not going to lie. I enjoyed it. I haven't had a burger for a long, long time. So yes, I had a burger.
Trying to throw you under the bus.
No,
It's not working.
No, it's not working. I enjoyed it, folks, and I have no qualms about it.
Send us an email. I know it. Somebody's going to send us an email of a juicy burger that they're going to sit down and have with Fred.
Every once in a while.
Or some fried chicken that we got last week.
Every once in a while, folks. Anyway, today we're on a totally different topic. Today we're doing some navigation. All right. We're navigating through the world of home care. And this is a very important topic that we're going to be touching on. So folks, if you're listening to us and, I'm imploring you to go get your friends, tell them the Liquid Green Show is on. Liquid Green Health Show is on. And, the more the merrier. There's no doubt. We have a wonderful guest. Now, there's no doubt that dependable home care services play a crucial role in our society, right? In supporting the well-being and independence of individuals, regardless of, their economic status, these individuals require assistance with daily living, right? And these services are offered in private homes, in residential settings and communities with a wide range of options that range from things like short-term care, long-term care, and other specialized programs.
Yes,
right.
There's a program for everything,
Yeah.
right? And so this week,
yeah,
we actually are going to be speaking with a very dear friend of mine, very professional.
Very dear friend of ours.
Sorry.
Okay, got to correct you there.
Of ours.
Yeah.
Yes. Well, I knew her first.
Okay.
Right.
But she's going to tell the truth when she comes on.
What? That you're both Guyanese?
Yes.
Anyway, Natasha Lee is the CEO of Passionate Care Home Healthcare Services. And she has been doing this for a while. She's going to talk to us. Natasha, I'm going to welcome to the Liquid Green Health Show. And I'm going to tell you right off the bat, we probably won't get to everything we want to talk about because I don't know what happens to 1 hour on Sundays, why it goes so fast. So you have been successfully serving the community for over 15 years. And
Yes.
You're a graduate from the University of Guyana, where you did sociology. And you earned your PSW
In Canada here.
in Canada,
Yes.
as well as you have been a nurse, right?
Yes.
Today, we want to invite you on to discuss, amongst other things, this. Let me cover up for to discover passion to care. And
Yes.
your handbook that you have written just came out recently. And how can, just before we start, just tell folks, where can they get this book? It's not a long read because it is a handbook. And I know you designed it to be left in every facility.
Yes, I did.
Right?
Yes. That's the motive.
That is the motive. And so my first question to you is, actually, we leave where they can get it till later on.
Yeah.
Because first we want to discuss and then people will decide, do I want to pick up a copy or not? And I hope by the end of the show, you will have many copies sold. All right. So
Yes.
Natasha, you hail from Guyana.
Yes.
And in the foreword of the book, you mentioned someone, you know what? I read it and I thought, I wrote by, it's a beautiful foreword. And
Yes.
it talks about you and the relationship, but we don't know who that was. Who was that wrote the foreword?
So the foreword was written by Ingrid Bowlers. She's the registered nurse. She was also she is a registered nurse, sorry, and she works pleasantly with the government.
Yes. Okay.
And she was my teacher for the PSW.
Great. What a small world. I didn't realize that. We know
Yes.
Ingrid mutually because she is a member of the Ebony Care Seniors Cooperative that we have previously discussed on the show.
Yeah.
Okay, well, thank you for clearing that up. It was beautifully written. And in your bio, which is where I want to start, it says, as a young child, Natasha endured various battles that many abused and battered women can identify with. It says you're a homeless single mother, a toddler, a baby on the way, and yet you were able to overcome all those obstacles and really get involved in a successful business. And what I know about you is you are one of the kindest, most caring people that I know. So what is it that inspired you? How did you first get started? When did you know you wanted to get into this field?
So I knew when I would be coming to Canada, I would be getting into the healthcare field from my sister. She said, go do the home in Guyana. I had finished the nursing, but I never worked as a nurse.
Okay.
I just did the certificate.
Okay.
And then she said, go do the what they call it?
Yeah.
The caring for the elderly, Guyanese people call it.
Okay.
So I went along and I did that, and then eventually got through to come to Canada.
Mhm.
And came to Canada. Then I had to take a step back to do the PSW.
Right.
Doing the PSW and getting my first job in the PSW field, work privately as a living caregiver. Then I started working with different agencies. Didn't like the care that the agencies are giving.
Right.
Went into the nursing home, work a few weeks there. Didn't like that care as well, because my belief is that when we're in our golden years, or at least when I'm in my golden years, I want good care.
We
If
all
I work all my life, I want somebody to love me and have time for me and do things that I would enjoy.
Right. But that's
So-
not always possible, is it?
No, that's not always possible. So working with this one particular gentleman, I can call his name because I already called and find out if it was okay.
Mhm.
Mr. Johnson, his girlfriend was Doris Ferguson.
Oh,
And she said to me, Natasha, why don't you open your own agency?
okay.
Sorry, let's rewind a little. That's after I told her that I would be quitting this particular agency that I'm working with. She said, well, I can't afford to lose you, so why don't you go ahead and open your own agency? And I said, Dolly, that's not a bad idea at all, but I don't know anything, because I remember I just come to Canada, all of this. But I don't know how to go ahead and do that. And she walked me through everything, and here I am today.
And that was how many years ago?
That was since 2007.
Wow. Okay. So, Natasha, you have your passion to care. That is
Yeah.
what I got from this book. I mean, I know you, but after we read the book, that's what stands out above all else. And I do believe there is. Can you tell us a little bit about the difference? For example, Frederick, you know this, when we're in the Caribbean, it's different. We care for the elderly differently.
Yes.
Yeah.
We can talk about the
Yes.
Caribbean because that's where we're from, but I'm sure this is the same in some places, the less advanced.
Yeah, certain parts of
Words,
Europe,
right?
certain parts of Europe will have similarities. Yes.
I'm thinking the Greeks, the Italians,
Yeah,
probably
yeah.
the extended kind of family home, right? But
Yeah, I think the culture have a lot to do with it, Janet. The culture, our culture have a lot to do with the care.
so in the Caribbean, what are some of the advantages then if you were to grow old at home in the Caribbean? What are some of the things that we're going to find that are good?
The outdoor,
Yes.
Mhm.
the
And you-
outdoor, definitely the outdoor.
and the friends dropping by,
Yes.
right? And the kids
Activity, the
running
food,
around,
the food, the fruits.
the fruits, the food, yes, the nutrition, very
Yes.
much so.
The homemade wine in the art.
Of course. No, that's on the good side. And actually, our mom went home for quite a while because it was cheaper to get 24 hours, 24/7 care, as well as, you know, the babies were around her, the friends would drop in, the church people would
Yeah.
come in and pray. All of those things would happen, and it was great. But then there were some disadvantages. What do you think would be an advantage to being here in this system for the elderly?
The only thing I see is the health. Yeah, that's the only thing that I can point out.
The what?
In Canada, for example, in Guyana, you walk into the Georgetown Hospital or the public hospital, and you would have to wait to see a specialist, or you go to the private to see a specialist. In Canada, we have an advantage where we walk into Sunnybrook Hospital and we get to see a special within a couple months.
Right.
We don't have to take any money out of our pocket to pay to see a specialist. In Guyana, we would have to, if once we walk into a private place, or we wait forever in the public hospitals.
Correct. And we know that a lot of people who would decide, a lot of people in the diaspora who would actually decide to go back home, that's one of the drawbacks. They like to stay in the more advanced country because of the healthcare system.
Yes.
And the of help if you were to fall and break a hip, for example, which again happened to my mom, right? Fell, broke a hip, and the rest is history. She actually died from complications much later.
Yes.
However, now you're in the book very early on, I think it's probably page 2, you mentioned that it's a quote you made from Mark Anthony. And you said, the quote is, if you do what you love, you will never have to work a day in your life. What is it that, what is the passion that you have for the elderly? I know not everybody has that. There are a lot of workers in the field, but they don't all have it. What makes you so committed?
I ask myself that question lots of times. I find being around the elderly, and this is the honest truth, it's therapy for me. I love it. I love smelling them. I love holding their hands. I love having conversation, hearing about history. All these things inspire me. Hearing their story, hearing what they went through, inspire me, that knowing that anything is possible, because maybe I'm talking to somebody that's 90 years old and telling me history.
Right.
Yes, those are the things that I love. I love it. It's unexplainable how I enjoy being there with them.
I know I'm exactly the opposite. I'd much rather be with the little ones. Right?
Okay.
And whereas I know another friend, she says, no, I don't want to be around the children. They're too noisy, they're so rambunctious, whatever, too much energy. But that's where my passion is, right?
Yes.
So you actually run an agency where you send nurses, RNs, RNAs, PSWs into the homes. What is the difference? Can you explain to us the difference between those acronyms, the RNAs, the PSWs, and their roles?
So RNA and RPN, they're the same.
Okay.
Yeah. The RN is the higher, it's above the RPN, and then falls the PSW. Right. The PSW is the RPN, and the RN depends on the PSW to give report, and the doctors as well. In some facility, you will see that the doctor would come to the PSW for reports.
More so than the nurse, but do you
more so than the nurses?
Do you have nurses that actually work full-time in most facilities and doctors, or not?
Not full-time, no.
Okay.
There are some places that doctors are one time a week. The doctors and nurses visit, but the RPN, yes, full-time.
Okay.
So, because it's more cheaper.
Of course.
To hire the RPN, because the RN is close to the doctor.
Right. And which brings us to one of the big problems in this whole dialogue, because the people who do what we look at as doing the bulk of the work, which is the PSWs, they're on the lowest rung, and there are so many disadvantages for them that there's actually a shortage of PSWs in the system right now, right? I know there's a shortage of nurses. There's also a shortage of PSWs. Now, what do you think is, why do you think somebody who gets into why would somebody who is a PSW go into this space, they know what they're going into, and they really hate it? Some people like yourself love the jobs. Some people are just doing it because they need to earn a living. But how does that impact on the people who, the residents, the people that they're going to serve? Like, give us an example of something.
That's a good question, Janet, and I'll honestly answer that question. And I mention it in my book as well.
Yeah.
If you're getting into this job here, this particular field, the PSW, and it's for the money, don't do it.
Mhm.
You'll be burnt out like yesterday. Don't do it. Do it for the passion, do it for the love. If you don't love it, don't do it.
It's
Because if I'm here to take care of your mom and you expect me to do my best for your mom, I'm replacing your mom. I'm replacing you, sorry, because you're not here. So I'm your eyes. And then your mom is doing anything she wants to do, opening the door, next door neighbor have to call and come and hit on the door and said, Natasha, Miss Shirley is up the street. What was Natasha doing? On the phone. The PSWs now, they spend most of their time on the phone. And as an owner of an agency, it gets me really angry. I don't know why is it that PSW find it that they're being paid for an 8 or 12-hour job, and the 12 or the 8 hour, they take it and spend it on the phone, neglecting the person that they're being paid to take care of.
I'm glad you brought that up because as you, and I think in the book you did mention something about love, right? Make sure that what you're doing, and I'm paraphrasing. Make sure what you're doing it with love. But again, this is a field that a lot of people with different personalities get into, and they're not trained properly to deal with this psychological stress. Statistics show that 1 in 3 of the caregivers, they have a high level of stress, and because they have a lot of things. There are a number of factors. The salaries are not compensatory. They have personal issues. Okay, everything from relationship to bills, long hours. So you find that when these people get into these situations, they bring these baggages with them, right? And then you have some people that you're caring for. They're not easy to deal with because of the state that they're in.
Exactly. Like Natasha, I'm going to ask you to tell us about the dementia patients, because that's an area where now we're finding as we age more and more the statistics. I don't have any statistics here today, but the onset of even early dementia and Alzheimer's is like crazy. Well, a lot of these folks aren't trained. So sorry, go ahead.
I saw a research, and I didn't pull it down, but it said something like, I don't remember when that research was done, but something like 61% of Canadians will be in that state of dementia at some point in time in life. So that's a very, very high number to deal with.
You better drink your ginkgo.
So if we don't have people that are properly trained, and I'm not just talking about training how to lift a person or how to move a patient, they must have some kind of psychological training.
That's what I want to ask Natasha. What kind of training? I know nurses go to the College of Nurses. I know if you're setting up a business, there is the Act, the Long-Term Care Act. But what is it for the PSWs who do the bulk of the work? What kind of training do they go through?
Just the PSW training, but we have special training, whereas this one, Dacia, that works with us, she would teach them how to deal with it. Counseling.
Okay. What do you mean?
So, for example, I'm working with a particular patient that has dementia right now. And she would ask me the same question over and over and over again. It's not my place to get angry or my place to say, I just told you that, today's Wednesday. And then 3 minutes after, she asked me the same question. What day is today? Today is Wednesday. I just told you. Why can't you remember? And the same thing over. I didn't eat anything. Yes, Mom, we had something to eat. I didn't eat anything today. I can't remember. We had something to eat. You had lunch just 3 minutes ago. It's your place now. It's not to talk in a rough way,
Right.
but to guide her. And it's good to look into their eyes. You just had something to eat, Mom. You enjoy that lunch.
Listen, Natasha.
In a calm way, because it would get you agitated.
Yes.
But also that is good. That is good for a well-trained person. Statistics also show that 96% of individuals receiving long-term care have unpaid or untrained.
And those are
the family members.
Yes, the family members. Right.
Who this condition is suddenly thrust upon them.
Yes.
They can't handle it. They have a job to deal with. They have kids of their own.
Or they quit the job to stay home, and then the money is less.
Right.
Yeah, so all of those.
So those are factors.
But Natasha, I'm going to make it personal now, because our dear Aunt Newton.
Yes.
We talked to a few people. She's 93. She just turned 93. And she is in the beginning stages of Alzheimer's.
Yes.
And your agency is the one we hired. Even though we have people and time, like lots of nieces and nephews, that could really be there. But I find, this is a question I have. I look at you and the person there with her, and the way in which they deal, there's so much patience, which I don't have as a relative. Do you think it's wise for relatives to be in this situation if they really don't have the training?
I wouldn't say it's not wise, but lots of time relatives live in the denial stage, always in denial. They always think she knows exactly what she's doing. She's just pretending. Yes. So that's how I wouldn't think it's wise, because family is the last one to come to that realization, to know, oh, my aunt is coming into dementia. They'll never accept it. Never.
They're not trained to pick up the
It's not just that, though.
It's accepting.
It's the whole fact that we know she has dementia, but then I don't know, the personality, there's just so many things that there's just not the patience.
Yeah.
Yes.
I cannot do that. I cannot listen to somebody say 24 times in 3 minutes. What, Well,
you're not trained.
That's what I'm
you're not
saying.
trained, Janet.
You don't even listen to me. You don't even listen to me.
Even me, I have to say, Janet, can you listen to me for 1 minute, please?
Yeah, she don't listen.
So I'll understand that.
I really take my hat off to folks in this field, right? Because
and Janet, not cutting you also, it has a lot to do with the hours of work that the PSW is doing.
Right.
When you put, if I take a PSW and put them in a 12-hour shift with a dementia patient for, let's say, 5 days, they're definitely going to be burnt out.
Yeah.
You can't put a 12-hour, one person for 12 hours in a dementia patient.
Now, another area of much concern is like there's choices. So now you send folks into the home. That's the bulk of, but we know that some people, like we had another aunt, she just got to the point where we couldn't lift her. She had to go into a facility, right? And what are some of the drawbacks that we have? Because there is, how do you, this is the bulk of your book. How do we choose these facilities? What should we look for? What are the
Okay, before you answer the question, before you answer, just hold your thought, hold your answer. Let me get to some email.
Oh yeah, and tell folks
where. Yeah, and for those of you folks, for those of you that are joining us for the first time, or you have joined us late, this is the Liquid Green Health Show. We are the Coxes, and our guest today is Ina Lee and Natasha Lee. We know her as Natasha, right? Yeah. She's the CEO of what's the name of her business, Janet?
Passion Passionate Care
Passionate
Services.
Care Services.
Mhm.
Okay, and we are discussing.
We're discussing the conundrum in the home healthcare system. I mean, our experience, Caribbean, Ontario, but this is evident across, I would say, most of the
Yes.
Pacific.
Right.
We're going to talk about Sweden when we come back as well, and
And
how
you-
they're doing things differently.
And you're hearing it all on the
Mhm.
Liquid Green Health Show on Reality Radio 101. So let me just get to a few email.
Mhm.
Fred, the first day of spring is tomorrow. Yes, that's good. That's good, but it doesn't feel like it, right?
And
Are they going to let you out of the home? Ha ha ha.
yeah, you're right. He's
Okay,
Jake, have a sense of
okay,
humor.
Jake. All right, I'll remember that. Here's one from Mike, and hello, Coxes. Happy belated St. Patty's Day to you.
Yeah,
Hail to Liquid Green, and that was written
Yes.
in green. Thank you very much for that one.
it's an Irish company, right?
Yeah, here's one from Monique.
Mhm.
Hi, Fred and Janet. A question for your guest. I see ads all over Canada that PSWs are in a high demand, and the job growth for this profession is booming. Is this true? And thank you.
So let's answer that question
Yes.
right now before we go to the others.
Okay, so there's a question here for you, Natasha. It says, I see ads all over Canada that PSWs are in demand, high demand, and the job growth for this profession is booming. And the
Is that
writer
a
wants to
true
know if it's true.
assessment?
Yes, it's true.
Okay.
It is true, yes.
How
Because I was
easy-
talking to a nurse just today from one of the government facility, and they're looking PSWs right now.
They're actually trying to get PSWs from other countries, the same as
Yeah.
nurses, right? They're trying to hire and to train. And this all came about so much because of COVID.
Mhm.
That's what we're going to get into. Do you have another email now?
Yeah, let me read another email before we get to that. Okay, this one is from Tim, and Tim says, thank you, Coxes, for having Fred's PSW on the air with you today. She is awesome.
Okay.
People are just picking on me today, man.
No, that's a compliment.
No, that's what I'm saying. They're picking on me. It's good. That's
Yeah,
good.
it could
Yeah.
be is
No.
you really need a PS. Oh, I know she's not a PS. Okay, great. I won't dissect it. And I told you, what did I
Somebody.
tell you? That somebody is going to send a picture of a giant hamburger that
Yes.
is.
Thank you very much for
for
that one,
Fred.
Greg. Thank you. Thank you.
He knows it's not for me, it's for you, right? Okay.
All right, so
So
let's
let
get
me-
back to the questions.
I forgot. Where did I leave off? You interrupted.
About the PSW on demand.
Yeah,
Yeah.
the question was
No, that was
demand.
there, but
Yeah.
before that, I was asking about. Oh gosh.
Okay, let me ask, why is there such a shortage? Is it because of the long hours? Is it because of the pay scale is not enough? Is this something that is right across Ontario, or it's outside of Ontario? Just
It's global.
a shortage of qualified healthcare workers. Why is that so?
My opinion is that the pay is not enough.
Okay.
Because if I have 4 children and I'm working 40 hours a week, it can't take 4 children, a single mom for the month, paying rent, gas, car insurance, and food, clothing, and the list goes on.
There's a high cost of living.
Yes.
High cost of living that's put a strain on
Yeah.
people wanting to go into that profession.
As a matter of fact, what the experts say, you can go to Amazon and get a job and actually earn more than you could as a PSW.
You're kidding.
All right.
Is that so?
Especially in the
Isn't
States. I
that
don't
bad?
know about Amazon here, but in the States,
Yeah,
yes. You can do it without Amazon,
without the stress.
without the stress, but Amazon is not exactly easy work either, right?
Yeah.
My question before the break was, which you talk a lot about in your book, what should we be looking for when we're choosing a facility? What are the main things?
Do a lot of research, Janet.
Okay.
I would advise family to do a lot of research. Research on the home. Know how, for a PSW to be in a home, how many patients does the one PSW has to take care of?
Right.
I would say let the maximum be 8, 7, 8, nothing more than that. My first nursing home that I was working for,
Mhm.
I was taking care of 11 of them. At 7 a.m. I had to get them ready to get in the dining room at 8. That was impossible. I was getting burnt out already.
Yeah.
And the feeding, and they want me to feed really fast.
Yeah.
Right.
Yeah.
And what I hear, that is during the day. I hear it gets worse at nights or in the evenings, or if it's a long holiday where staff are off, that the ratio actually gets worse than that.
Oh, yes, that is true. Because they don't bring in as much PSW in the evening that works in the day. The day shift have more PSW than the evening shift.
Okay.
And is that because they would have to pay more for evening shift than day shift? Is that it?
No, that's just cutting costs, because if in the day I'm bringing 4 PSW, in the evening I'm only bringing 2.
Mhm.
Oh.
And of course, people go to bed, so they figure at night.
Yeah, they figure you're not
Yeah.
doing anything. That's why lots of people are getting bed sore, because nobody's changing them in the night and repositioning who has to be repositioned 2 to 3 hours.
Wow.
And now so it comes down, it seems, to the bottom line, that for so many of these facilities, it's the money. But if they
Yes.
don't have enough money, then I hear that it might come to the point, I don't know if it's already happened, but I know in Jamaica, when we were there, in the hospital, we had to bring our own water. We had to bring our own bottled water. So they say, bring the water so Miss Bennett can take her medication. All right, that's after she had a fall. And so here, I hear there's a shortage in some of the homes for diapers. So you might have residents being changed twice for a day because they don't want to, the cost
The
of
cost of
diapers
getting
is so much.
diapers. Yeah.
Do you see stuff like this? Is that?
Oh, yes, I do. In some of the private homes, you would find that.
Okay.
They would tell you to bring your own diaper because they're only given 1 or 2.
Wow.
Yeah.
It's not bad. Huh?
So you and I at some point earlier, I know, a couple of weeks ago, we were talking about the agencies and how they actually charge. Can you share with us some of the stories out there about what agencies do and how much they actually charge a facility and how much they actually end up paying a PSW? What are some of the costs involved with this?
So PSW are paid through agency $35. And some agencies can afford to pay that because they're charging the facility $65, $70 for a PSW. So to get that contract for that particular facility, you have to pay for the contract as an agency.
Okay.
So even if I'm a worker there and I'm complaining about this agency that's coming in and they're not doing what they're supposed to do, my word doesn't have anything because that agency has already been paid to be in there.
Okay.
Okay.
I want to get back. Okay, go ahead.
Just before you get back, on the whole thing about complaining, good point you bring up, because there's 2 levels of complaints. There's a complaint of the worker, and there's a complaint of, say, the caregiver who has a resident, who has a mom or dad or uncle, aunt in the facility. What is set up for people to make complaints when they see things they don't like? Can anything be done? Is there like a process to complain?
The director of care is there that you can always complain to. In the government facility, you can go to the higher level.
And what about, I know in Ontario, they use the ombudsman.
Yeah.
That somebody can complain to.
Yes.
Do you really find that when a complaint is made, it's addressed?
Oh, yes. They handle it right away.
Okay.
Yeah.
Okay. And that kind of answer one of the 2 questions that I had, because I was going to ask about, violence and stuff that takes place in the resident. How is it dealt with? But
especially
and I can give you an example to answer that question. Years ago, I was working for a particular person. She's mentioned in one of my testimonial as well. I went into work 7 a.m. and privately. And I said, she was in the dining room, but it was too early because breakfast doesn't serve until 8. So I said, Mom, do you want to use the washroom? Let's go to the washroom. When we got to the washroom, and I said, okay, Mom, stand up. She couldn't have stand. She said, oh, there's pain. I can't. She couldn't have lifted her arm. She said, it's paining. I said, what's wrong, Mom? And I did like this to her clothes, and her arm were marked with black and blue.
Oh, wow.
So I called her, the nurse that was in charge, and I said, can you come and look at this? Because I don't want to be blamed. Remember, I just came. And we had to call the family. And as soon as we called the family, they sent to the emergency, and her arm was broken. Shoulders was broken. So we don't know how long that happened, if it was a day before,
Yeah.
or 2 days.
Yeah, it could have been a week, and then the
Or
pain
it could have been a week.
increase. Yeah.
But the family did take it forward, and it was well dealt with.
Okay.
Okay.
Do facilities have a place that if there's a problem, they can take a person away and put them like a violent?
Yes, there is a floor for yes. The aggressive ones, yes.
Okay.
There is floor for that.
I wanted to ask about the 3 different types of care. They have the long-term, the adult care, and the home-based care. What are who determines,
where
the patient is placed?
Okay, I see.
Who makes that determination?
Okay. So, Natasha, I think what Frederick is saying is, if there is a decision, my aunt, my uncle, whoever, we know they need care. They go to the hospital because of whatever, COVID, whatever, and then a decision is made. Is a decision made by the caregiver, the power of attorney, the doctor, who is there one person or is it a team of people? How does that work?
So initially the family is the one that always decided, you know what, my aunt really need extra help. And let's say the family cannot afford it. So the family is this telling the family doctor. The family doctor can take that and refer it to the right social worker. And the social worker is they call it a worker, is gonna come in and do an assessment and send the assessment back to the family doctor. And then they'll take it from there. Another way it can go is that the family can decide, I'm gonna keep my aunt in the home, and they can hire a PSW to come in.
Okay.
And the family can decide, I don't want my family, I can't stay in the home anymore, it's too expensive. And then they can start looking into a facility. And once they can't live alone, that means they can't go into a retirement home. They'll have to go into a long-term care.
Yeah. Wow. And Frederick, you also mentioned the adult daycare. That's a space that's for folks. My mom here in Canada, she did, and she loved it. These awesome people. So it's daycare for adults.
And there's lots of activity there. It's good for them.
But my mom was actually told she needed to find somewhere else because in our Jamaican vernacular, she said to one of the teachers, "I'm going to lick you." And they thought she was being aggressive. My mother is she's one of the gentlest people in the world. In Jamaica, we laugh and say, "I will thump you," right?
Yes.
It doesn't
it's
mean
a dialogue.
Up there, it's like a no.
It's a different culture. It's a no.
The culture, yes.
It's like a no exceptions. And we had to move her from there.
Zero tolerance.
That's the word I'm looking for. Zero tolerance. We had to move her from there. Now, do you think do they allow cameras into the nursing homes?
On the main floor, not in rooms.
Not in rooms?
No.
But that's where most of the damage happens. Most of the abuse
happens.
Most
of the abuse,
Okay, now elder abuse, besides physical or emotional, what else do we see as some of the elder abuse issues?
Besides physical and emotional.
Or what do you consider the most troubling abuse for elderly people?
Neglect.
Okay.
Yeah.
Yeah.
Neglect.
And that
So
would
you're-
be
you're
for food.
That's a big one, yes.
Not
Yeah.
feeding them on time,
Not feeding them on
taking
time.
care, not
Mhm.
changing the patient
Yes,
when it's
yes,
necessary.
yes,
Okay.
yes, yeah.
And this happens a lot in these.
I would say that's the number one, neglect.
Yeah.
Yeah, especially when they're at that stage where they can't complain to
Yes.
say, you know, and you actually, so somebody with dementia, you would kind of doubt and say, she did eat, I did change her. She's lying, but it's true.
Yeah.
Because
Okay.
sometimes the right thing kick in and they know exactly what's going on.
Yeah.
Okay.
I know
Yeah.
after COVID, the Ontario government here, and I think this happened all over the world, because what happened with COVID? Most of the people who died, apart from people with
Yes,
conditions,
yes.
were the
It's loneliness, yes.
and it was the
And
elderly.
that was neglect.
Right.
Yeah.
Now, loneliness, that's a big area, isn't it?
Yes.
And I was looking at University of YouTube.
Mhm.
There was something about another in Sweden, and they were comparing two families who elderly people who had been married for 50 years, one couple, and another couple 62 years. So Fred, you're getting there, eh?
Yeah.
You're getting there,
You soon
42
have to
years.
call me.
No comments.
You soon have to call me in.
Right. I'll be calling you in for him, okay?
Yes.
On the beach in Jamaica, I said, Natasha, call, look at.
Come and take care of him.
But the issue was when people have been together, couples, for so long, and they get separated, and we saw this a lot. The loneliness, the devastation, the unhappiness. I think this is the death. What was your experience with the facilities during COVID? Can you just share some of what happened?
Oh, Janet, that's the hardest one for me to share.
Yeah.
So one of my clients called me and said, Natasha, mom have COVID.
Mhm,
This is during COVID time.
mhm,
And they believe she's not going to last too long. Because remember, they had give them an amount of days to last.
mhm.
She said, we're going to the nursing home tomorrow morning. You want to come? I said, yes, I'll come. So it so happened that she was so lucky she was on the first floor. So we were there outside and the nurses brought her to the window and put the phone on speaker so she could have heard what we were saying outside.
Mhm.
It was the saddest moment.
Yes.
And all we saw her at the window and we could have waved at her.
Yeah.
Hopefully she could have was seeing us.
Yes.
And the next morning she passed.
Oh, really?
Yeah.
Oh,
I think that
Yeah.
was one of the most inhumane
Yes.
actions that the government did.
Yes.
So, regardless of the situation, they should have
Mhm.
allowed people to at least have that final moment. They
Together.
could have made
Even
they could have made
days
arrangements.
without
Yeah,
knowing.
they could. It was very inhumane.
Of that is
Yeah.
right.
Yeah,
It doesn't go away.
yeah. It's the final moments, and
Yeah.
you're watching your family. It's terrible.
Yeah.
I have a question.
Just what they did in Sweden was they're building special facilities to accommodate couples. So if one person has a stroke and the other person can attend to them, but not strong enough to stay in their own home, they can now opt into one of these agencies or into one of these homes
Mhm.
designed for two people, two single beds, a little kitchen, etc. And they can still have a good quality of life. And so the lady in Toronto was saying, in Canada was saying, she was in BC, why can't we do that here? But of course, we don't have time to answer that. But
Yeah.
these are I was going to ask you some of your solutions before we end. But Fred,
Yeah,
you
but
wanted
yeah,
to
there's
read a few more
a listener
emails?
just wrote in and
Mhm.
asked a question that I was going to ask.
Yeah.
Is home care better than nursing home care? And
100%.
if so, why?
Mhm.
And
100%. One-on-one home care is better than long-term care. 100%. Once you can afford it, keep them in the nurse. But also you can work the system.
Mhm.
You can do a PSW and have them go into the facility as well.
okay.
You can hire a PSW, call an agency, and centipede, because if you can't be there, you need somebody to advocate for you in a long-term care facility.
Okay.
So you can hire a PSW to go in to take care of your loved one. Let's say 4 hours in the morning, 4 hours in the evening.
Yes.
Okay.
That's a way that you can work it as well.
And you can
Whereas-
also get wheel trans, like you can get transportation for pickup for medical appointments.
Yes,
You can get meals on wheels. There's quite a few
So lots of options.
services available.
lots of option that you
Lots of
can
options.
work out. If you do decide and put them in a facility, you can work this, you can do your own scheduling. Meaning today's Wednesday and I want to take my mom to the mall because you don't want to cut her life short, not because she's in a facility. Take her to the mall. Okay, my PSW is going to be there for 4 hours. Sign her out for the 4 hours.
Fred and Janet, your mic is on mute.
Yes, it's something is on mute.
Oh, sorry.
okay.
Yes.
In the future, Natasha, I know
Okay.
you are looking to get into the nursing home in the smaller facility, like a home. I know you already have a couple of homes that you're just waiting to go through how to set them up
The right procedure, yes.
in terms of setting up these homes.
Yes.
And I know this is going to be wonderful because as the question was asked, I believe that the smaller home, fewer people, let's say you have 10 beds as opposed to 200.
Yes.
Here is going to be different.
Yeah.
If this is a house, we can use what they call the Eden effect.
Or the classroom, the classroom effect, where you have less students and so more attention could be paid to individuals.
Yes, yes,
The
yes.
house can look like a home. They can have a garden. They
Yeah.
can do little crafts, and you know what I mean.
Yeah.
So I believe that's something I can see you going there, and that's
Yeah.
where I put Fred when he gets to that point.
Yes.
In care. Here's another email. Here's one
Yes,
from
from
Jody. And Jody says, Cox's, this lady, your guest, is amazing. She has brought tears to my eyes. Finally, a health-related business owner who cares, right? We all have heard so many horror stories about nursing homes and PSWs that just do not care and are abusive to their patients. Thank you, thank you, thank you. Your guest is an angel.
Okay,
Thank
and
you
now
very much for that.
Natasha, that was wonderful. Could
Oh,
you,
Jody, thank you.
if somebody wanted to use they've heard you today, they have seen you, and they believe you, because we know that what you're saying is gospel, is true. You're not just saying this. You wrote the book. You have given the advice. How do people hire your agency? What do they need to do?
All they need to do is call me at 416-835-7399. Or they can go on the website and just send a message, and then I'll reply to them right away, or someone will reply to them.
And
The,
your
web,
business again
the
is
website is Passionate, PASSIONATE-FORCARE.com.
yeah,
It's passionateforcare.com.
Yes.
And the phone number is 416-835-7399. And we also have another another request
and
from Tommy.
Your email is passion for number 4 care, is it?
Passionate, Nate, N-A-T-E.
Passionate and the number 4 care
at Gmail.
at gmail.com.
Yes.
Once again, that's passionate and the number 4 care at gmail.com. We have an email from Tommy, and he says, hello, Coxes. I may have missed the information, but where can I purchase Miss Lee's book? Thank you. Is this available on Amazon?
Yes, it's on Amazon.
Okay, so it's on Amazon, Tommy. You just go to Amazon and you type in Passionate Care, and it will pop up, okay? Passionate to Care, available on Amazon, and the author is Natasha Lee.
And honestly, when you read it, I went through it pretty quickly. And I love the fact that you gave so many personal stories.
Yes.
And you even offer, oh my goodness, Frederick, we read through some of these. You even offer inspirational quotes and affirmations that the caregiver can sit quietly and say these just to
Wow,
be
calm them down. Yeah.
right?
Yeah.
Rooted and grounded in purpose. I am doing all that I can. Here's
Yeah.
another one. I will only compare myself to myself. And another one which I love, I am enough.
Wonderful.
That's it. And there's a whole list of these.
Yeah.
So, you know, very, very, there she is.
Let me get to another email.
I'm
Here's
gonna
what,
blush.
and Hank says, PSWs, nurses, and these types of healthcare workers are overworked and underpaid.
Mhm.
And we did.
Yes.
If I were a politician, I would make a law for the minimum that you can pay these wonderful people, and it would be more than they are making now. Janet is so right. It's all about the money. Instead
Yes.
of making several millions of dollars a year, they should make less and pay their workers more and get the proper supplies to help these people. It's all about greed. It makes me so mad.
Yeah.
Thank you very much for that, Hank.
Yes.
And one
And
from
I
I
agree.
was going to ask Natasha, do you want to respond to that, Hank?
No, I agree with Hank. I definitely agree because that's exactly how I feel.
But
mean,
then, is it impossible? Like, because so many are in that position, is it really that they can't, do they have to charge that much in order to offer the quality of care?
it's not about the
No.
care, it's the money.
It's the money, Janet.
That's what it comes down to. It has nothing
Yes,
to do
it's
with
the money.
care.
Listen, just the other day on the news, I know we're soon to end the show,
Mhm.
but just the other day on the news, they're saying agencies are overcharging. So if a nursing home are paying their personal support worker, just giving an example, $20 an hour, why can that particular nursing home pay their PSW $30? They
Right.
prefer to pay the agencies,
Yeah.
maybe, who says maybe $80 to $90 an hour. Why? What's the reason why?
Does that have, again, I'm asking, does that have anything to do with the way in which the Nursing Home Care Act? Is there any kind of stipulation that has to happen?
So change the act. Change the act whereas you can pay the PSWs and they're willing to work for your facility.
Yes.
Because
sorry, go ahead.
PSW have 3-4 jobs. Why? Why is it that, and the government should put a cap that after so much thousand, that's when a PSW is going to pay taxes, because most of their money is gone in taxes.
And guess what? We have like just a few minutes left, and you have one more email before we do.
Yeah.
What you just said, Natasha, is so important. And you know what happened during COVID with the spread of the disease? Because PSWs that have 2 and 3 jobs were from one facility to the next, and they were responsible for spreading a lot of the infection.
Yes.
What's our final
So again,
email?
it comes down to it's the money. That's what it comes down to.
Yeah.
Lisa, and Lisa says, blessings to Miss Lee.
And this is in bold, big writing.
Right? Blessings to Miss
Thank
Lee.
you, Alisa.
Make sure that we can see and read it properly. She's telling the truth. This program should go viral. The truth. Thank you. And thank you for that one, Lisa.
We're going to ask Lisa, sure she go to everybody listening.
Yeah.
If you could go on YouTube right now, as soon as we're done.
And share this.
And share this.
Subscribe.
It's the Liquid Green Health Show.
Yeah.
It's on YouTube. And ask people to listen and to subscribe.
Yeah.
All right.
Yeah.
And with that, Natasha, your website again was passionate for care.
Yes.
.com, and the phone number was
835-7399. And what's the email, Natasha? Could you give that out?
Passionate, the number 4, care@gmail.com.
So that's passionate, the number 4, care@gmail.com.
And here's the book that's available.
It's available on Amazon, folks. Just go to Amazon and type in Passionate for Care, and it's going to come up.
See, right. Natasha, you work fantastic. Not even 1 ounce of nerves. We have to have you back. Anyway, Frederick, how are we going to wrap this up?
This has been a wonderful, wonderful show. As a matter of fact, we didn't get a chance to cover everything, but time doesn't give us that leeway. And so with that, folks, we want to thank our guest, Natasha Lee, for visiting us this evening and for sharing her expertise and experience with us. And with that, we would like to say, as usual, to end the show, is that good health is central to human happiness and well-being. It contributes significantly to prosperity and wealth and even economic progress. As healthy individuals, we can be more productive and may even live a little bit longer. So until next Sunday, same time, same station, this is Janet and Fred Cox saying, let's stay healthy on Reality Radio 101. Have a wonderful evening.
Thank you for listening to the Liquid Green Health Show with your hosts, Fred and Janet Cox, right here on Reality Radio 101.